Bicuspid valve is present between A. Left atrium and left ventricle, B. Right atrium and right ventricle, C. Left atrium and right atrium, D. Right ventricle and left ventricle. The connecting link between glycolysis and Krebs' cycle in aerobic respiration is ARUBP, B. Acetyl-CoA, C. Citric acid, D. Oxaloacetic acid. Symptom exhibit during icteric phase of viral hepatitis. A. Tarry stools, B. Shortness of breath, C. Yellow-colored sclera, S. Light, frothy urine. Which of the clinical finding indicates the patient is experiencing hypokalemia? A. Edema, B. Muscle spasms, C. Kussmaul breathing, D. Abdominal pain. A condition characterized by prolonged PR interval more than 0.2 seen in ECG is called A. Second-degree AV block, B. Mobitz type 2 AV block, C. First-degree AV block, D. Complete block. Which vitamin deficiency is common in association with INH therapy in tuberculosis? A. Riboflavin, B. Thiamine, C. Niacin, D. Pyridoxine. The antidote for heparin is A. Vitamin K, B. warfarin, C. thrombin, D. protamine sulfate. Neural tube defects can be prevented by A. Supplementation with vitamin B complex, B. Supplementation with hydantoin, C. Maternal folate supplementation, D. Prophylaxis with valproic acid. Fourth cranial nerve is A. Trigeminal, B. Abducens, C. trochlear, D. facial. Which of the following observation is suggestive of acute gallbladder disease? A. Dark-colored urine, B. Tarry stools, C. Constipation, D. Polyuria. Highly malignant, rapidly growing tumor of cerebellum seen in children is A. astrocytoma, B. meningioma, C. medulloblastomas, D. ependymoma. Which one of the following can precipitate an acute gouty arthritis? A. Emotional stress, B. Lack of exercise, C. Excess alcohol intake, D. Excess smoking. The route of administration of Schick test is A. Intramuscular, B. Oral, C. Intradermal, D. Subcutaneous. To control bleeding in a child with hemophilia A, the nurse would expect to give A. Albumin, B. Fresh frozen plasma, C. Factor VIII concentrate, D. Factor II, 3, 10 complex. The most serious complication of meningitis in young children is A. Epilepsy, B. Blindness, C. Peripheral circulatory collapse, D. Communicating hydrocephalus. The artery that supplies blood to the diaphragm is called A. Inferior mesenteric artery, B. Suprarenal arteries, C. Inferior phrenic arteries, D. Colic arteries. Congenital absence or closure of a normal body orifice or tubular organ is called A. Fistula, B. Atresia, C. Hernia, D. Stenosis. The premature closure of the sagittal suture is called A. Scaphocephaly, B. Oxycephaly, C. Acrocephaly, D. Anencephaly. The largest volume of air, which can be expelled from the lungs during maximal expiration, is called A. Tidal volume, B. Residual volume, C. Inspiratory reserve volume, D. Expiratory reserve volume. A low-pitched, continuous gurgling sounds caused by secretions in the large airways is called A. Wheezes, B. Rhonchi, C. Coughing, D. Strutter.